Good morning to you.
Good morning to you.
Yes.
Body after baby, not so easy. And, you know, losing that weight, Dr. Ahluwalia, hard enough, but now it looks like people end up just heavier than they were ever before, right? This new study?
Right. There's two parts to this. One is, you know, something that most women have known, that after you finish your pregnancy, it is hard to lose that weight. Some of it comes off very quickly, and some of it takes a while and takes a little bit of effort. So this study proved that that's actually true, that 3/4 of women ended up being slightly
heavier,
slightly heavier than before. But what's more startling is that 1/3 of the women actually ended up being overweight or obese 1 year after pregnancy. So the concern is pregnancy now becoming a contributor to obesity in this country?
Well, is that because, are people concerned that, you know, like sometimes when you're pregnant, you just think it's your free pass to eat, and instead of getting like the things you need for your body and that baby?
Right. I think the misconception is, and this myth has been propagated, is that when you're pregnant, you're eating for two. It's not true. When you're pregnant, you're eating a little more than what you're supposed to, maybe 300 to 400 calories more.
So you're eating for 1.3.
Yeah.
Not two. And so, again, I think that, you know, in our society with all the temptations that we have, most people live their lives sort of not eating this or not eating that. And when you get pregnant, suddenly it seems like it's okay because you're eating for the baby.
Chemical dynamic here that's causing
Obviously,
this,
there's a lot of things with hormones that change, and there's a lot of, you know, imbalance from normal.
So what's the advice do we have here?
Well, the advice is moderate exercise. That's really important. After you...
Before, during, and after?
Yeah, and more so after. You know, please make sure. Now, breastfeeding also helps. So, you know, that's another reason that you should breastfeed your
I think that's what helped me, but I was doing it for two.
Right,
so
but I think, you know, single women who have a job, they're so busy. It's hard to take time out for workouts, you know, with a baby. But if you can, maybe even a walk with a pram.
With the baby.
E-cigarettes.
Yeah, so they're not safe, as we know, for these kids, and yet in some states it's legal for kids to go out and buy them. Like millions and millions and millions of kids can get their hands on these.
How crazy is that? I didn't know this, but when I found out, I was aghast that there are, you know, multiple states where they allow kids to go into a store and buy e-cigarettes.
Is this, doctor, because they haven't thought about the laws yet, or is this a purposeful thing?
Well, I think that all the focus was on cigarettes, and these e-cigarettes sort of slid in as this, you know, device, not necessarily a cigarette. And initially there was this misconception that the vapors were harmless.
That they were okay. That's what I originally thought.
People still think that. They use that to justify their use.
Not the case. But even more interesting is that there are a lot of states that may ban cigarettes indoors, but don't ban the e-cigarettes indoors. So you're still being faced with secondhand vapor smoke.
Well, it's just going to be a matter of time before that.
I know, but it's...
Sansone, let me ask you a question. You have friends who drink and smoke. The e-cigarette thing, were a lot of them for you? A lot of them on the e-cigarettes?
People who are really hooked on the cigarettes will do the e-cigarettes, but not people who are just picking it up for the first time.
Okay.
But people who are trying to get off smoking.
Yeah.
Right, but
and you look good, by the way.
Yeah.
Thank you.
Okay.
I think that's for adults, but I think for kids, you know, this is a free pass.
We're
it's
talking,
like, you know,
about the baby weight thing, not the cigarettes.
And it's the entry thing, right?
Yeah.
This is the last thing you want.
Drug.
Now you're telling children it's okay to be hooked to nicotine as long as you're not smoking, which is not right.
See, that's a sad part of that, because the idea was e-cigarettes will help people who smoke get off of cigarettes.
Yes.
But if you this is an entry drug for kids, right?
It is, because it's legal.
Yeah.
Get away with it. Okay, and Congress just made it a little easier to protect medical marijuana in many states, correct?
Yes. So medical marijuana is still a Category 1 substance, which means that the FDA believes that there is no medicinal value, highly addictive, and the side effects are immense. So it's still in that category. But what has happened is that it gives researchers the ability to now research it without worrying that they're going to be arrested because they're researching marijuana. So I think the big thing, even though, you know, the medical dispensary industry is very happy about this, but as far as medical practitioners are concerned, we are not entirely clear on how well it works, what you give it for.
Yeah.
So you don't have a firm stand on this one way or the other?
We don't know.
Yeah.
So I think what this is going to do is to allow researchers to actually be able to do the research without worrying that they're going to get arrested. You know.
Okay.
So I think this is good.
Thank you, Dr. Ahluwalia.
Always nice to see you.
Appreciate
Thank
it.
you.